So relapse refractory diffuse large B-cell lymphoma has been the unmet need for several years. In the past, auto-transplant was the goal for most patients because it did offer a 40% chance of cure. But as we all know, not everybody is transplant eligible. And of the transplant intended patients, only about half of those achieve chemosensitivity to be taken to an auto-transplant. Besides high-risk patients such as primary refractory, early relapse diffuse large B-cell lymphoma, they seldom gain any benefit from an auto-transplant, and thus there was a huge unmet need in the third-line space after failure of auto-transplant or for patients who did not really respond to second-line treatments, and that's where CD19-directed CAR T-cell therapy has created a huge change in making the needle move forward with regards to a potential 40% cure for those patients who go through CAR T-cell therapy in the third-line space. So in my opinion, I think CAR T-cell therapy is probably the biggest advance of the decade for patients with relapsed refractory diffuse large B-cell lymphoma. And given how wonderfully well they have responded, CAR T-cell therapy has demonstrated response. It was intuitive to take it in the second-line space. And now we have CAR T-cell therapies approved in the second-line high-risk relapsed refractory diffuse large B-cell lymphoma, and thus now creates a new challenge for us, which is what to do with patients whose cancers do come back after being treated with CAR T-cell therapy, or patients who are not CAR T eligible as a result of the manufacturing time wait, or as a result of inability to get to an academic center, or as a result of just being CAR T ineligible because of the economic toxicity. And I think for those patients, we have hope now in the form of several other agents, and I think top of the line here would be CD20-directed bispecific T-cell engagers. Epcoritamab gained FDA approval just a few weeks ago for patients in the third-line diffuse large B-cell lymphoma setting, and in this, with this agent, the responses are robust, the responses are durable, so long-term follow-up is of course very welcome. Besides BiTEs, I think I'm very pumped about other agents such as antibody-drug conjugates, such as Loncastuximab, antibodies such as Tafasitamab in combination with immunomodulators like Lenalidomide, and I think only clinical trials are going to help us pave the way forward. There is a lot of activity with regards to multiple other novel agents that are coming down the pike for our patients with relapsed refractory diffuse large B-cell lymphoma.